everybody. I am Dr. Ravindra Babu, and the Director of Medical Services at Apollo Hospital, Hyderabad. First, let me thank each one of you, the media personnel who are all here, each one of you. Sincere thanks to each one of you. I will explain why we are here. Ankle and foot. We know that ankle and foot is very, very critical for mobility, right? Without the ankle and foot function, we will not be able to walk. And it's also a very complex area to deal with actually, right? Treatment of the ankle and foot is also extremely complex. So that's number one. Second thing is, we also know that diabetes is very common in the country, and lots of patients who suffer from diabetes end up with foot problems, ankle and foot problems, right? So when there is a problem, then it leads to loss of foot most of the times. We do amputate, and there is also life is endangered because of the diabetes resulting in a foot and ankle problem. So it's a widespread problem. Ankle and foot is a widespread problem, and more so is a diabetic foot, especially because the incidence of diabetes is very high. So there is a lot of patients who suffer from this problem. Now, when we have a foot and ankle problem, or we have a problem with diabetes and foot and ankle problem, we do not know where we should be reaching to. Who is the best specialist to treat? Actually, it is not a single specialist. It's a multidisciplinary team, right? There is a foot and ankle specialist. There is an orthopedic who specializes only in foot and ankle. There is a podiatrician. There is a vascular. There is a physiatrist, physiotherapist. There are multiple people involved in this program. And only when these people do the right treatment and when they are competent to do the right treatment, the outcomes are going to be better. Very, very happy to announce that we have the best. Very proud to say that we have the best team who can deal with foot and ankle problem and diabetic foot clinics. Right? We have the Excellence Center for Diabetic Foot Clinic. So the goal of treating the diabetic foot is preservation. It's not about we take care of the wound, we amputate, we save the life. No, it is about just not maintaining the anatomy. Rather, the goal of this team is to make the patient walk. That's extremely important. I amputate and then keep you alive. We are half dead. But we maintain the mobility and we maintain the anatomy is it gives a lot of outcome for the patient. So that is the whole goal. So very happy to announce that we have the best center. We have very comprehensive care which is available. Now we will, with help of you, will request you people to let people know that this is the center where in case you have a problem, come to this place for a better outcomes. Right? Now I have in this one of the very important member of this team is Professor Venu. He is actually he's an Indian. He belongs to Hyderabad, but he's been working at King's College London. His specialty has been the foot and ankle. He's been doing research, and he is one of the pioneers working at the international level. In fact, he is the president of the Society for the International Diabetic Foot. This is where the programs are made, the clinical programs, the guidelines are made, and he is the president. Very proud to have him here. So he is a member of our treating team, and I will request Professor Venu to talk more about what is this diabetic foot, what is this ankle and foot and ankle problem. Thank you so much.